This scenario takes place on a med-surg unit. The patient is a 27-year-old white female who came in from a psychiatric ward. She's having difficulty with coping and is very anxious. She's also a smoker. She currently has a lung infection, so she's on IV antibiotics. The nurse is played by me. The night shift nurse is played by Tiffany, and Jessica plays the patient.
Hey, okay, let me tell you real quick about this patient. This is a 27-year-old female, Mrs. Taylor, and she came in from a psych ward. So she's here because I guess she's here to treat a lung infection, so we're giving her antibiotics. But I guess she has some anxiety and coping issues, whatever. That's what she came in for. She's a psych patient, you know.
Yeah, I know.
So she is a smoker, and we can't smoke here. We can't have her smoke. She's on oxygen. She's on her antibiotics. So all she wants to do is smoke. She's like, I'm gonna smoke, But she probably just wants to go outside to escape. She's a psych patient, We can't trust her. So that's basically it. So she just has a lot of anxiety. I've just been giving her meds, and it kind of calms her down to kind of get her off my case. So
okay, well, that's good. That's enough. I guess we'll go get a report on the rest of the patients. Thank you.
Okay, all right.
Oh, Tiffany, can you come in really quick?
Yeah.
Hi, I was just wondering if you can, since before you take off, she has her 7 a.m. IV antibiotics that are scheduled, but I have my other patient that really needs her meds right now, so I was wondering if you can give them to her before I take off?
Yeah, real quick. I can do it real quick.
Okay, thank you so much.
So I'll go do that. So she's on IV antibiotics?
Yeah.
And it's already set up in the pool in her room.
You
I'll
just
just
need to
grab
hang
it.
the bag and yeah.
Okay.
All right, thank you.
All right. Hi, ma'am. How are you? I'm gonna give you your antibiotics real quick. Your nurse, I'm going home right now actually. So your nurse will be in a minute, but I'm just gonna set this up for her. Okay?
Can I just go have my cigarette already?
No, you can't get out of bed. No, you can't.
I just need to. I'm sorry.
You're not able to get out of here.
I don't even know why am I
Let me
here?
put these rails up.
I have so many other things
She's
to
gonna
do.
bring your
There's
anxiety
no point
pills.
in me
You're gonna be
being here.
fine, okay? Let me just put these up. Okay?
Can I just smoke?
No,
I
you're not smoking.
really
You're
need to smoke.
you have to have your oxygen. Okay, you're not smoking right now. Just lay in bed. This is not the psych ward. I have to go home. Your nurse will be in and explain everything later.
I don't even need to be
Lay
here.
down, lay down, lay down. I put these rails up. Don't get out of bed. Okay, she'll be back.
I just
Okay.
want to go. I just need to go now.
No,
I
you need to
have
sit
better
down.
things to do.
Sit down. She's gonna bring your pills. It'll calm you down and put you to sleep, okay? All right, she'll be in a minute, okay?
I don't understand these people.
Okay, Sam, I went to your patient. I gave her antibiotics. She's really agitated. She's trying to get out of bed. I put the rails up, trying to keep her in bed. So I'm just gonna leave it to you. I gotta go home. I was supposed to be off like 10 minutes ago. So I gave her antibiotic. I hooked it up. It's running. You can go check it. I didn't document, so you're gonna have to document.
Okay.
And then yeah, so I just gave her antibiotics, and
I'm sure with her
she wants to
anxiety, she'll
smoke.
feel better. Of course.
So she needs some medications, maybe restraints. I don't know. This girl is crazy. You know, this girl's at the psych ward. Oh my gosh, this is a med-surg floor.
Right.
Really, we don't need these kind of patients.
I know, right?
They can't handle them over there.
Right.
They're nurses, aren't they? All they do is just write stuff down, you know.
Yeah.
Okay.
Okay, well, I'll deal with it.
All right, I'm going home.
All right, thank
Okay.
you. Hi, Miss Taylor. My name is Samantha. I'm your nurse for today, okay?
Okay, I'm so glad you're my nurse now. The other nurse, she was just horrible. She was treating me like I was nobody.
Oh, I'm sorry to hear that. Well, hopefully I can help you out. I'm going to give you your lorazepam for your anxiety since I know you're feeling a little agitated, the nurse told me.
She was telling you I was feeling agitated.
Well, that you were a little anxious, so
She
will
has-
help you calm you down, okay?
She has no right to say things like that about me.
Let me sit up your bed. How long have you been here?
I've been here a few days. It's just I don't even understand why I'm here. I just want to go smoke, and they don't allow me to smoke.
Yeah, our facility doesn't allow that. So, but you know what? I can talk to your doctor, and we can probably prescribe a nicotine patch to just kind of ease that for while you're here.
But I don't want the patch. I just really want to smoke.
I understand, but we can't have that in this facility. So I'm going to go ahead and give you your med. And your O2, where's your O2? Where's your oxygen? Your oxygen mask?
Oh, that thing? Oh, you'll never find it. I don't even know why they put that on me. I mean,
Okay, well you need your oxygen to help you with your breathing, and you have a lung infection, so you know we need that for you. So I'm gonna go grab you another mask, and then I'll come back and we can talk for a little bit. Okay? Would that help you?
well, I mean, I think it's once you get me my cigarettes, I'll calm down. I think that's what will help me. I don't think this medication will
Yeah.
work.
Okay. Well, I'll be back, and we can talk a little more about that. Okay? Hi, Miss Taylor.
Hello.
I'm back. I'm just gonna sit with you and talk with you for a bit. Okay?
Okay.
So how's the medication working?
I think it's been working a little bit. I feel a little better, a little more rested.
A little more calm and at ease?
Yeah.
Okay, that's good.
Yeah, and I mean, I think I will take that nicotine patch now that, you know, because I really need that.
Oh, that's great.
And
Okay, I'll
so-
definitely call the doctor and put an order for it, okay?
Okay.
Okay, so how are you feeling?
You know, it's been kind of hard being here, to be honest. It's been difficult just
I
being in a
understand you
hospital.
came from a psych facility, right? What brought you into the psych facility, if you don't mind my asking?
You know, what happened is that we were in a car accident a couple months ago, and it was my best friend. We were like sisters, and she passed away, and I was the only one who
Sorry to
survived.
hear that.
And it's just been really tough on me now. Even driving in a car, it's been really hard to even drive.
Right, I can imagine.
And it's just, I don't even know what to do. It's, you know, so that's why I've kind of, I don't feel
So
the
you
same.
feel very anxious when you're in a car and stuff like that. Do you have any things you do to calm your nerves and relieve that anxiety?
Usually that's the reason
Right.
why I really want my cigarettes. That's helped me.
Okay, that's understandable. Before in the past, when you've been anxious from other situations, did you do anything to relieve the anxiety? Can you think of other things that helped you a little?
You know what, before, I used to go to church a lot, and that really used to help me, but I mean, I don't do that anymore.
Is there anything else that you do?
I mean, with church it was prayer, and I used to do yoga with my best friend, but
Right, of course. Okay, well maybe praying a little more might help you as opposed to the cigarette. Well, actually, we can call spiritual services, and a chaplain can come and pray with you if that would help you relieve your anxiety. Would you like that?
yeah, I'm Catholic. Are they Catholic?
Yeah, we can provide a Catholic.
Okay. Yeah,
Okay.
I'll take that.
Okay, then I'll go ahead and call them so they can come in and check on you and
Okay, and
talk
do you
to
know about my lunch? Do you know when it'll be here?
Yeah, at noontime, so I'll go ahead and check on that too and grab it for you.
Okay.
Okay, I'll be back, okay?
Okay, thank you.
No problem. Hi, Dr. Collins. This is Nurse Samantha from the Med-Surg unit. I'm calling about the patient, Mrs. Taylor. She came in from a psych ward with a lung infection. She's currently getting treated with the IV antibiotics. She's also a smoker, and she came in because of the lung infection, but from the psych ward she had difficulty coping and some anxiety. So I sat down and I talked with her, and she was in a car accident with her best friend, and a drunk driver hit them, and her best friend unfortunately did not survive. So she's having difficulty with that. So I was wondering if I could recommend, maybe a nicotine patch to kind of ease her right now because she can't smoke on the unit. And also I was thinking of calling a chaplain to kind of help her, pray and cope and just to have someone to talk to. So I was wondering if that would be okay. Okay, thank you. Bye-bye. Okay, correct.
Hey, how was your shift? How was, what's her name, Mrs. Taylor?
Oh, actually, she complied with her antibiotics, and actually we did get to start her on her nicotine patch because she was
Good.
refusing it. Yes, so she's currently on that. I did speak to the doctor about that, and also I was talking to her a little bit because she was anxious, and I actually found out that she was in a car accident a while back with her best friend.
Okay.
And her best friend sadly died. So she's
unfortunate.
Yeah, so every time she gets into a car, she's really, really anxious. So I think that's why she's smoking a lot, trying to calm her nerves.
So she's smoking to do that? Okay.
Yeah. So,
and taking her out of Am still?
Yes, and that's what gave her her too. So also, she said that she was really religious before the accident, so I recommended calling the chaplain here. So the chaplain saw her during my shift, and that really helped her. So I don't know if you want to call him again today and have him come in.
If it helps keep her out of my hair, then yeah.
Okay. Well,
But
yeah.
that's good that you sat and talked with her, because I couldn't sit there and talk with her. She was driving me crazy.
Yeah.
I need my cigarettes. I need this. I need that. So, and I work night shift for a reason because I don't want to do as much. So
Right. Okay, well, I'm just, passing you off report, and I know you have other patients to check on, so.
yeah. Okay. Well, thanks.
No problem. I
All
hope you have
right.
a good shift.
Okay.
Bye.
See you later. This scenario is a hospice scenario. It takes place in the patient's home. This is a 55-year-old white female who is diagnosed with stage 4 colon cancer. She's in the last few days of her life, and I play the nurse, Jessica plays the patient, and Samantha plays the daughter of the patient. And the therapeutic communication will be taking place between the nurse and the daughter.
Hey, Mom. It's a little cold.
Hello, how are you?
Oh, hi.
Hi, my name's Tiffany. I'm the hospice
Samantha. I'm
nurse.
her daughter.
Nice to meet you.
Nice to meet you, too.
Hello, Mrs. Smith. My name's Tiffany. I'm going to be taking care of you, okay? How's she doing?
Well, she's pretty much no progress. She's still a little unresponsive. She just sleeps all day, pretty much.
Okay. Is she on which medications?
She's currently on morphine.
Okay, and someone came in to talk to you about how to give those properly and when to give them.
Yes, I've been doing it for a few days now.
Okay, and how about for eating?
She hasn't been taking anything or eating anything for like the past maybe 3 days or so.
Okay, all right. I'm gonna let you spend a little bit of time with her. I'm gonna set up my paperwork and get started on that, and then we can talk a little bit if you have any questions about what's going on and
Oh yeah,
just your
definitely
feelings about things like that. Have you had a chance to talk to the doctor?
No, it's really hard to get a hold of them and get a response from them. So maybe talking to you will help me out.
I'll be happy to answer any questions that you have. So I'm gonna go ahead and set up my paperwork in the dining room, and then we'll talk after that, okay?
Okay, sounds good. Thank you so much.
No problem. Okay, Sam, so let's talk about, first of all, do you have any questions for me? Anything you'd like to ask?
Well, actually, they diagnosed her with like a couple weeks to live, and it's been a few days now that she's been on the hospice care. No one's really come to talk to me about it and to ask me how things work or how I'm handling it and feeling about it. It's pretty overwhelming and kind of scary, actually. So, maybe you can help me with that.
I'm sorry that you feel like no one's addressed this for you. Hopefully I can help you feel a little bit better about this.
Yeah, I would
and
appreciate that.
feel a little more comfortable with this because you are her primary caregiver.
Yes, I am.
Okay, that's good. Do you have any other family members that are helping you?
Well, I'm her only daughter, so I've been taking on the load for now.
Okay.
Yeah.
So I know that you met with the doctor and the case manager yesterday about about how your mom is doing. Why don't you tell me about how that meeting went?
Well, it went really frustrating. I can't seem to get any answers, and they told me that she had just a few weeks to live, and now they're telling me just a few days. So it's I don't know, it's hard to explain. Just a month ago, she was fine, and we were gonna go to the movies, and then all of a sudden this is happening. I just feel like it's happening really fast, unexpectedly. She's only 55. How do you explain that? So it's scary.
Yeah. So it sounds like it didn't go very well for you.
No.
Okay. In order for me to help answer some of your questions, can you tell me a little bit more about how your mom has been doing the past few days?
Well, like I said, she's unstable. She's not eating. She's just laying in bed all day. She doesn't communicate with me. I touch her and she doesn't react. She won't open her eyes. So it's hard to know how she's doing. I don't see progress. I don't know what's going to happen from here on out.
Okay. And you said that you've been doing the medications.
Yeah, they taught me about the morphine, but I feel, why are you giving her morphine? Can't that kill her? I don't want to give her that. I don't want her to die.
Tell me about what do you know about morphine? What all do you know? What did they educate you?
Well, I know they said it's for her pain, which I understand, but I also know someone could die from it, and I find that scary.
Okay. So it sounds like you need some more education about the morphine, so I'll be happy to tell you about that later on. But why don't you tell me more about, you said that your mom was doing fine a month ago.
Yeah.
And why don't you tell me more about what her illness means to you and your family.
Well, it's been very hard on all of us. I've been taking it the hardest. I mean, like I said, she's only 55 and I haven't had children yet, and I want her to, to have that interaction with with her grandchildren, and they're not going to have that, and it saddens me, and I don't know how to deal with that and cope with that appropriately.
Okay. We talked about earlier that you wanted to do what's best for your mother.
Mm-hmm.
Tell me more about what that means for you.
Well, I definitely want her to be comfortable throughout this process and free of pain. So, I really want to make sure that I do whatever possible that I can do to make sure that that happens.
Okay. I'm gonna, let's go sit over by your mom, and then we can address more about, I can educate you more about the morphine and how that manages the pain.
Okay, that sounds good.
Okay, so you had some concerns about morphine.
Mm-hmm.
You said that you feel that it can cause someone to die.
Right.
Well, I'm going to tell you a little bit about it. Some of the side effects can cause the breathing to slow down and your heart rate to slow down, and to help, and it also helps manage the pain, which is our primary goal with your mother right now. The dose that she's on is 2 milligrams every 4 hours, and that's a very small dose, and I can assure you that that will not cause her to die. It's going to relax her and keep her free of pain during this time, and we spoke that was what you wanted. So as it's getting closer to closer to the end of her life, how do you plan on coping with this situation? Because I know that it can be tough for you, and so what are your, and I also want to make sure, I'm her nurse, but I also want to make sure that you feel comfortable and you have a way to deal with this on your own.
Right. Well, I mean, this is, pretty sudden, and we haven't had a loss in the family in quite some time. And as a family, we are religious, so, we attend Mass every Sunday. So I'm hoping, I can do something with that to help cope with it. I do have family to help me and support me throughout the tough time.
Okay, so you said you attend Mass. Would you be interested in having because through the hospice we have a chaplain that comes out. Would you be interested in having the chaplain come visit and talk with you?
Yeah, that actually would be very comforting.
Great. I can give him a call and set up a time for him to come and talk with you about that.
You hear that, Mom? They're gonna get a chaplain to pray for you. Oh my God, she's really cold. I don't think she's breathing. I think she's passed. Can you check her?
Yes.
Is there a pulse? Is she okay?
Sam, your mother's passed.
Oh my God.
I'm so sorry. I'm so sorry. Hi, Dr. Andrews. Yes, this is Tiffany, hospice nurse. I'm on a case with Mrs. Smith. Yes, she's a 55-year-old female. She was diagnosed with stage 4 colon cancer, and she's in her home. I just wanted to report with you. I'm here with the family now. She did pass at 3:02 p.m. So I just wanted to report to you. Family is doing okay. She did express to me before that she wanted to speak to a chaplain, so I think that this would be a good time to involve the chaplain. So I'm going to go ahead and give the chaplain a call and have him come to speak with her and any other family members that would also like to do that. Okay, so I just want to let you know I'm going to go ahead and submit the paperwork, and I'll let you know if I need anything else. Okay.
This funeral takes place in a psych facility. It'll demonstrate a 47-year-old male. It is Latin American, and he's diagnosed with schizoaffective. He is reported to be hypersexual, and the patient will be Tiffany. I will be the nurse, and Samantha will be the charge nurse. Good afternoon, Richard. My name is Jessica. I'm going to go ahead and be your nurse for the day.
Oh, you could call me Dick.
I'll go ahead and call you Richard. I just wanted to inform you that you'll be next for the shower.
You gonna come too?
That's a little inappropriate, Richard, but I'll go ahead after your shower. We'll go ahead and talk about your today's goals, okay?
Okay. Now that I'm done with this lunch, gonna take my shower and go see about that nurse.
Hello, Richard.
How you doing?
I see that you took a shower, so I'm gonna go ahead and speak to you a little bit. Is that okay? Okay, so what is your goal for today?
Just, chill in my room. I don't want to go to those groups. They ain't for me.
Well, the doctor's gonna be coming soon, and he's gonna be, ordering your discharge papers. So it's good for you to show up and to show that you're participating. Okay?
Okay.
So I see that you're taking Risperdal.
Yeah, I am. It's okay.
How's that working for you?
It's okay. It works better than the last thing I was taking, so.
So
it's
you're doing okay with that one?
I'm doing all right, I guess, So enough about me, baby. What's up with you? How you doing today?
That's a little inappropriate. First of all, my name is Jessica. So we're gonna go ahead and you can go ahead and call me Jessica, okay?
Okay, Jessica, you got a boyfriend?
You know what? It's a little. We're talking about you, so you know what? I'm gonna go ahead and step away for a little bit. Give you some time. You're acting a little inappropriate, okay?
As long as you come back, girl.
I'll be back in a few.
Okay. Mm.
Hey Jessica.
Hi Samantha, how are you?
Good, how are you?
Good, thank you.
So, how many patients do you have today?
You know what? Today I have 5.
How are they going for you?
All of them are everything's going pretty well. Just I did want to actually inform you that Richard is one of my patients. He's been acting a little bit inappropriate.
So, are you going to go ahead and document that?
Yeah, that's exactly what I'm doing right now. So I'm going to go ahead and document it.
Okay, well thank you for letting me know, and you just keep me posted if he's acting more inappropriate or hasn't changed or anything throughout the day. Maybe we can reassign a different nurse or something.
Sounds great.
Okay, well just keep me posted, alright?
Alrighty, thank you for checking in.
No problem.
Hello, Richard.
Hey, girl.
I'm going to go ahead and give you your medications. Okay? So here's your cup of water.
Thanks, girl.
Here's your
You
Risperdal.
can call me Dick, I
You
told
know-
you.
I already told you that I'm going to go ahead and call you Richard, okay? That's very inappropriate, and on your documentation it says Richard. So that's what I'll go ahead and be calling you,
Girl,
okay?
you feisty. I'm Latin American too. We like to be feisty, don't we, girl? You
That's-
Latin American, girl?
You know what? This is not about me. That's very inappropriate, okay?
Okay, whatever. I'll take these. What is this? My Risperdal?
Yes.
Okay.
Thank you very much, Richard. I'll go ahead and come back in a few to talk to you, okay?
Okay, I'll be looking forward to that, girl.
You know what? I'm gonna go get a chair. I'll be back. So before we get started, Richard, can I have you go ahead and recline your chair back up, please?
Okay.
Thank you. Okay, so now that we've given you your medication, how do you feel?
I feel a little relaxed. I feel better. I feel okay. I'm more relaxed than I was earlier.
Okay, so I wanted to ask you a few questions. How are you doing with the activities, like we previously mentioned about, showing?
I went to group after lunch for a little bit. It was okay, They had some helpful things to, about communicating and stuff. It was okay.
Okay, that's good. They do have some regarding your medication, so if you have any questions regarding your new medication, you can go ahead and ask them, okay?
Okay.
Okay, so after this, where do you plan to go for discharging? I know you're getting discharged soon.
I think I'm gonna live with my sister, cause she does well and she takes care of me. So I think I'm gonna go there. I think that's what's best for me. I was talking to my psychiatrist about it, and I think he agrees that I should go with my sister because I think it'll be good for me.
Okay, you mentioned your psychiatrist. Do you have any appointments to follow up to go see him once you're done discharging?
I'm supposed to see him 2 times a week on Tuesday and Thursday nights for like a couple hours. So I think if I stick with that, that's gonna help me too.
And you have transportation?
Yeah, my sister can take me.
Okay, and is she your support system?
She supports me.
Okay. Okay, so I'm gonna go ahead and I'll be back in a few and I'll come back to check up on you, okay?
Okay, that's good.
Hey Jessica, how's your day
Hello.
going so
It's
far?
actually going pretty well.
So how is it going with your patients?
You know what? Everything's going pretty well. I got with Richard. I was having a little trouble with him before, but I do have to say he's calmed down after I've given him his medication. So I think everything's gonna be okay.
Okay, good. Well, I'm glad to hear that. I'm glad he's being a little more appropriate and respectful. But if anything else happens, just let me know and we can figure out what to do from there, okay?
Sounds great. Thank you so
All right.
much.
Okay, bye.
Bye.
Oh, Nurse Jessica! Can you sit down for a minute? I need to talk to somebody, please. It's important.
Okay, Richard, I'll go ahead and I'll talk to you.
I'm feeling a little lonely. I just need somebody near me, Oh, did you cut your hair, girl? Your hair is so pretty. I love your hair. Oh my
Oh,
goodness.
excuse me. Don't get near me. I'm sorry.
Girl, you know that we're both Latin American and that's our culture. We are a loving culture, okay, girl? You know you like it.
That's not something that we go
Come
by
here,
here.
girl.
in
Come
this
on,
hospital.
come on,
No,
girl.
do not touch me. Do not touch me. I'm sorry. I have to go report this to the charge nurse.
Whatever, girl. Charge nurse. Report me.
Hello, Miss Samantha. I just wanted to let you know that I had an incident with Richard right now. I'm going to go ahead and document it, but I wanted to report it to you. He was getting a little inappropriate. He was trying to touch my hair and trying to touch me. I've already told him several times, and he still does not respect me.
Okay, well, that's good that you stepped away from the situation, and I know it's uncomfortable, so I'm going to go ahead and reassign another nurse. I'll probably just be the one taking over for you for the rest of the day, okay?
Okay, thank you. I really appreciate
Yeah,
it.
no problem. Okay. Hey, Richard.
Hey.
My name is Samantha. I'm another nurse on the unit. Jessica told me about your guys' little incident earlier.
I don't know what she's talking about.
Okay, well, she told me, and I'm gonna take over for her today, but I'm just letting you know that that behavior is unacceptable in this facility, and I will not tolerate it, so you need to act right, okay? And I'll be back to check on you throughout the day, okay?
Okay, girl.
All right.
She is fine. I am getting lucky in this hospital. This is so good, okay?